Good afternoon. How are you doing?
Doing good.
Good. Yvette, my name is Tina Nordine. I'm your family nurse practitioner student today. I'm going to be completing your cardiovascular assessment, peripheral assessment. But before you get started, I just want to make sure that you do consent to me videotaping and sharing this information with my instructor, as well as the assessment today. So do you consent to allowing me to do that?
Yes.
So Yvette does consent to having the assessment done today. And before you walked in, I know that my MA was able to perform her blood pressure, and she was able to perform the blood pressure bilaterally on both arms. She did that supine as well as sitting up. And we were able to compare those blood pressure results, and what it showed was equal on both sides. And why we did that is we're looking at orthostatic hypotension. So if you were to stand up, your blood pressure would drop, which yours did not. And then also if there had been a 20 millimeter of mercury difference in either arm, then that would show a sign of vasculature problems or maybe even a blockage. So that's why we did that. So looks like you had normal blood pressure, 120/80 in both, about 120/80 in both arms. So that showed that you are normal in that area, okay? So the next thing we're going to do is look at your jugular venous pressure. And I'm going to be able to do that by measuring the vasculature here. And in order to do that, I do have a few instruments that I'm going to use, just so I can walk you through each one. It's not going to hurt. The first one is just where I will put in your sternal notch, just to place it there, and then I will measure where the pulsation, where I see or inspect and see the pulsation in your neck or your jugular vein. And then I will measure with a measuring tape here. The reason I have my light is I may have to visualize it with a tangential, meaning from the side, and I will be able to do that with my light if I'm able to see the pulsation, okay? So first I'm going to ask you just to turn your head to the left, and I'm just inspecting the neck area, the chest area right here on the front, on the top. And I'm looking to see if I see a jugular vein. Maybe lift your chin just a little. There you go. And then I'm going to utilize a few. I'm going to place this into the sternal notch. And how I find that is just where there's a V shape here in your clavicle, between the clavicle area. And then I see the pulsation. So the highest level of pulsation that I see is where I will place my line, and then this is perpendicular, so this and this is perpendicular to I see the pulsation, and I measure it from that point, the highest level of pulsation. Normal would be 3 to 4 centimeters, and what I'm seeing with yours as I'm measuring here is about 3 centimeters, so that would be normal. All right. So very good. So I've inspected your jugular venous pressure and was able to inspect as well. So the next step would be to look at your carotid arteries. So first I will inspect, and then I will palpate, and then I will also auscultate the carotid arteries, okay? And I'll do that bilaterally on both sides. In order to do that, I'm just going to ask again if you'll turn. What I can do is I can go to your tracheal area and just go lateral of that, and not high, because you don't want to feel the carotid pulses really high, and you definitely don't want to do to palpate the carotid pulses on both sides at the same time, because then you may block the blood flow to the brain. Okay, so I feel your carotid pulse. To describe and grade that, I feel a normal sinus rhythm. I feel it about a 2+ in pulse grade, which is normal. And then I'll feel that on the other side as well. So I'll feel your trachea, and just go lateral of that. And I'm using the pads of my fingers. Not too hard, and just feeling for that pulse there. Now we'll also auscultate, meaning that I will listen with the diaphragm and the bell of my stethoscope. So just a little chilly here on my stethoscope, so I'll auscultate. Very nice sound. And then I will do that with the bell as well. And what I'm listening for is any murmurs or bruits, and I do not hear anything of the nature. And I will palpate as well after I've auscultated. So when I was palpating earlier, I was also palpating to see if I felt any thrills, and that means like a cat-like purr, and I did not palpate any thrills. So I was able to inspect, palpate, and auscultate your carotid artery, and everything seems normal there. Okay, so the next step is just to inspect the chest area. We'll move down, and on this inspection, I'm looking to see if there's any concave, any asymmetry, any type of abnormalities, and I do not see any abnormalities in your chest area. I'm going to look at the apical and precordial pulses, and or any type of pulsation, and I do not see any type of pulsation at this point. So what I'm going to do is I'm going to palpate with the pads of my fingers again into the second intercostal space, and so I'll feel down in the second intercostal space. And I did not let you know this, but on when I'm palpating, I may have to lift your breast just so you can feel comfortable with what I'm doing, just to feel under the breast, which is where the mitral area is. Okay, so this first area is where the aortic is. This is on the right side in the second intercostal space. I'll palpate first. And then on the left side, second intercostal space, is the pulmonic. And then further down, third, fourth, and fifth intercostal space, those that would be the Erb's point. So those aortic, pulmonic, tricuspid, into the third, fourth, and fifth intercostal space, which would be Erb's point. And then I will also, underneath this breast here, will be your mitral. In the mitral area is where I will pulse, find if there's any pulsation. That will be the point of maximum intensity. I don't necessarily feel anything there. Sometimes you can and sometimes you cannot actually palpate, but as I auscultate, I may be able to hear that as well. And when I'm auscultating, when I do auscultate, I'll be listening for any murmurs, any abnormal sounds. At the point of maximum intensity, I can hear the S1, S2. There may be some, I forget what is it, S2 splitting as well. So I'm going to auscultate as well. And I'm going to auscultate with both the bell as well as the diaphragm. And then I'm going to have, as you're laying, and then I'm also going to do the same thing exactly as you're sitting up, okay? So in the second intercostal space, listening for the mitral, aortic. Mitral's down here. And I'll use the bell as well. And then I will go over second intercostal space here, pulmonic, using the bell as well. Down into the third, fourth, and fifth, which is Erb's point, diaphragm, as well as the bell. And then over to the mitral area, which will be here. And with the bell as well. And what I'm hearing are normal S1 and S2 sounds. There's no abnormal sounds in there. I did not hear any bruits. I did not hear any murmurs. So we have inspected, auscultated, and I'm so sorry, forgot to tell you. I did say it early, but I am going to ask you to sit up as well. Very good. And I'll do the same thing in the same areas as I just did, with both my diaphragm and my bell. In the second intercostal space. On the right. And then the left. And then down third, fourth, fifth, using the the bell as well. And then over to the mitral, where the point of maximum intensity would be, as well as with the bell. All right, very good. Everything sounds good so far. How are you feeling?
Feeling good.
Any questions or any concerns?
No.
All right, very good. So the next step, I'm just gonna kind of lay you down just a little bit again. Are you comfortable?
Yes.
Okay. So the next step is to look at your peripheral exam. And when I say that, I'm looking at your extremities. And first I'll inspect your extremities, meaning your arms and then your legs, okay? While I'm doing that, I will do that also bilaterally. So I'll do this arm and that arm, and then we'll move down. So the first arm, what I'm doing is, I'm so sorry, but my hands may be cold. I'm just feeling you going down, and I'm feeling for any warmth or cold if you're cold. And as I go down to your hands, I'm gonna look at your fingers and looking at capillary refill. Looks good. Yes, very good. And I feel warmth, and I'll feel that on the other side as well, on your left-hand side. And then also looking at capillary refill on this side as well. And looks good. Your upper extremities are looking very well. I will feel for any edema, any types of shunts, any type of abnormalities, any clubbing. I don't see any cyanosis, which would be blue. I would be looking for these items in your lower extremities as well. I don't see any hemorrhage or any tar staining either. So any of those abnormalities I'm not seeing at this point. So in your upper extremities, you also have some arteries that we'll look at. And the first one will be the brachial. And in order to find that, it would be on the inside here, right along where your elbow meets on the inside. And I'll feel for your brachial artery. And I want to also kind of compare that to your brachial artery on your left arm as well. I'm feeling 2+ there, which is normal. And then in order to do that, I will feel on the inside, right where the elbow bends or flexes. Again, 2+. And I'm feeling symmetrical on both sides. Then we'll go down to kind of where your thumb, I'll follow along down your thumb to find your radial artery. Again, I feel 2+, and I'll do that bilateral on the other side, down your thumb to feel the radial. And again, 2+ on that side. So we've looked at your upper extremities, and now we'll move down. I'm so sorry, I have to auscultate those as well. So I've palpated, and now I'll auscultate with both my diaphragm and my bell. So again, the inside, listening for the brachial artery with my bell as well. And the radial with the bell as well. We'll do the other side, bilateral side as well. And then the radial artery with the bell as well. All right, very good. So far that you have a normal exam. We'll move down into your peripheral and your lower extremities. And we also have arteries, large arteries actually, called the femoral arteries, which can be found in the fold of our leg. I'll also indicate and describe and grade those arteries as well. So, and I'll compare them bilaterally. So the femoral, you can kind of go from the hip inward, and you can find in the fold of your leg the femoral artery. And in a clinical situation, You would probably not have the pant legs on. In what we're doing here, I'm gonna have you keep your pant legs on today. Again, from the hip over, and in Bates it does say, you know, a normal pressure pulse grade is a 2+, and what I'm feeling is a 2+. Again, auscultating the same artery with my diaphragm and my bell as well. And again, this would be on skin, as well as everything else that we've done today. And your femoral. What I'm feeling for, again, thrills. I'm not feeling any thrills. I'm not hearing any bruits. Nothing abnormal. Good sounds there. So we'll move on down. Good capillary refill. There's no, you know, like I said, we'll look at your legs as well as we move down the extremities. I would feel for any warmth or tenderness, any edema, varicose veins, any clubbing. I would also look at your toes. You do have some toenail polish today, so really can't look at the capillary refills, but for purposes of what we're doing, that is something that we would do, and I would make sure that your feet are not cold or anything like that. Again, on the bilateral side as well, feeling down, and same on that foot. No abnormalities, no varicose veins, no shunting, no capillary. The capillary refill is good. No hemorrhaging, no tar, staining, anything like that. Okay? So we've done the femoral artery, and what I'm going to do is I'm just going to ask you to bend your leg here, and I'm going to check for your popliteal artery. And how I do that is behind your knee in the popliteal fossa. I'm going to have my fingers meet, and then I'll go out until I can feel the popliteal artery. Okay? So I'll go around to the back of your leg into the popliteal fossa, and see if I can cut my fingers there and go out a little bit to see if I can feel your artery. Again, a 2+ artery there on your popliteal. Okay, and then we'll ask you to do the same on this side, bilaterally. So the popliteal, fingers are meeting together in the back, coming out just a little to see if I feel the popliteal. Again, a 2+ there. So very good, and you can stretch your legs out if that's comfortable for you. All right, and then we'll move on down to the lower extremity, and then we would auscultate and palpate those as well. My apologies that I didn't already do that. So with the bell and the diaphragm of my stethoscope. You feeling okay? Mm-hmm. All right, we're almost done. We're getting there.
Take your time.
Thank you. You're a great patient. Auscultating after I have palpated and inspected. And very good. Everything sounds good. So we'll move down to the dorsal pedis. Those are the arteries on the tops of your feet. And what you can do is and I will do this bilaterally as well, and I will compare the two. How I usually find it is just kind of along the big toe into the middle area of your foot. You can feel the dorsal pedis. Again, it's a 2+ on that side. Again, on this foot, a 2+. Auscultate after I've palpated. With the diaphragm and bell of my stethoscope. Diaphragm and bell of my stethoscope. And then we also have the posterior tibial that is on the inside of your medial medius. That's medial, I don't know that word. So we'll have to look that word up. And again, that's just right kind of where the little bone is on your foot, on the inside of your foot. And we can feel that. Again, a 2+, and this side, a 2+. And I'll auscultate, and after I've palpated, again, auscultating to hear if there's any abnormalities, any murmurs, any bruits, and I do not hear any of that. We'll do it with the diaphragm and the bell of my stethoscope. The other thing, as I'm down here on the bottom of your extremities, I'm looking at your toes. If there's hair on the toes, that's actually normal. If there's no hair and the toes are shiny, that would show signs of poor vasculature or that you're having issues with blood flow. So it looks like you do have a little bit of hair there, so you're normal. And this completes your cardiovascular exam and your peripheral exam. Before I end, do you have any questions?
No.
Very good. So my findings are normal throughout. I have inspected, palpated, auscultated, and made sure that we looked at your cardiovasculature from top to bottom. So thank you so much for being a wonderful patient, and I look forward to seeing you in about a year for your next yearly exam.
Thank you.
Thank you very much.